Hi, I'm Dr. Matthew Durkin at Malera Eye Care. I'd like to show you a little bit about our Optomap imaging system. This is a 3D representation of the inside of the eye coming through the pupil. We're looking at the back of the eye called the retina. You can see there's going to be some blood vessels. This gets out to about 200 degrees off center, much wider field than most ocular images. And it gives us a quick and easy way to take a good look at the majority of the retina without having to do any dilation drops. Here's what we often are looking at in people's eyes. In the center is the optic nerve. The optic nerve takes all the information from the eye and sends it to the brain. It's very important that this stays nice and healthy. It can be affected in conditions like glaucoma, or other neurologic conditions may affect the optic nerve. Here are the retinal blood vessels that bring blood out to the retina and back to the body. We really want to make sure there's no blockages or leakage from any of the blood vessels, and we try to follow as far out to the edge that we can get and just make sure that there's no issues there. Another thing we can look for is changes in color and pigmentation out in the periphery. Sometimes we'll see lighter areas or darker areas like freckles. You can see lesions like growths or tumors in rare cases. There's also the potential to see things like floaters. These are little cloudy areas inside the gel that fills up the inside of the eye, and some people notice this as little spots that move around in the vision. They're very common, and I've noticed them, this is my eye, I've noticed them in my eyes especially after I got about past the age of 35. They get a little denser and thicker. Everything in the retina that is on this image looks very nice and healthy. This is just an example of the different kind of things that we can look at when we take that Optomap image. And I hope this was informative and helpful to you guys, because I know people often wonder what the Optomap is, how it works, and what it does.